All right, welcome back. As workers return amidst the second wave of the COVID-19 pandemic, mining companies are concerned about the level of complacency at work and in surrounding businesses. One of the main players in the industry has decided to intensify testing drives as well as its awareness campaigns on the virus. To tell us a little bit more, we are joined by Dr Jameson Malemela, who's the Senior Vice President of Health and Employee Wellness at Sibanye Stillwater Mining, and radio personality Pitso Molemane, a diabetes activist who defeated the coronavirus while living with both diabetes and high blood pressure. Pleasure to welcome both of you. Thanks again for being our guests.
Good morning, Leanne.
Good morning, Leanne, and thank you, and morning to all the listeners.
Absolute pleasure. Thank you. So let me begin with you, Dr. Malemela. Tell us more about the awareness campaign and why you felt that it was very important to embark on it.
Thank you, Leanne. Sibanye Stillwater's, founding was on the basis of improving lives. So when we mine, we want to improve lives. So it's very, very important for all our employees to ensure that they come to work and it's safe to produce, and it's also safe to go home and safe to be with their own families and other members of the community. So the campaign that we're running currently is that we need every single one of us to acknowledge the seriousness of this pandemic. And as such, employee well-being is right at the center of this because, as you understand, the virus itself will go. But the problem is, if it affects our employees, we have got no business. If it affects our families, we have got no families to look back to. Yeah. That is the crux of our campaign, Leanne.
Yeah, and a very important campaign because miners are going back to work at this time, and we obviously focus on the compliance issues. But I'm going to stay with you for just this question. How compliant are you when it actually comes to the availability of PPE for workers and ensuring that health protocols are followed? And obviously, how do you do this in a mine?
Yeah, Leanne, is very, very complex. Luckily, we've got enough resources because right from our group chief executive officer and the top executive leadership in February last year, 2020, we developed protocols because remember there was a lot that was unknown with this virus. So across the business, every single person that joined after lockdowns was actually inducted. So we have a very standardized approach across all our operations. Remember, we operate in different countries. We're an international player. But focusing on South Africa alone, we ensured that everyone who comes on board, we did proper induction. We've got training. Mine workers every year when they come back, they've got to undergo some training and skills that are needed. They are being re-emphasized because we really need a safe production across all our operations. So that's how we maintain that. So there is monitoring, there is compliance with the requirement by the Department of Labor and Employment to have dedicated people to enforce compliance across our own operations. And of course, we're saying our employees own up, and we're very, very excited that majority of them have actually owned up to this PPE and other non-pharmaceutical measures that we are using to try and mitigate the transmission of SARS-CoV virus in our workplaces.
All right, I'm going to bring you into the conversation now, Pitso, because you've got a very interesting story as well, and I know that you are kind of a brand ambassador, making sure that people abide as much as they possibly can by the regulations that have been put in place. So, Pitso, tell us your story. I mean, I know that besides having diabetes, high blood pressure, you also got a COVID, and you've managed to come through this. But I'm not sure in what condition you're in. Obviously, people are, struggling with the so-called long COVID or Longhaul COVID. Talk to us about how it's been for you.
Indeed, thank you so much, Leanne. Very good morning to the viewers. Leanne, it has never been an easy story for me since I was diagnosed with COVID, defeating it and surviving from it. I'm proudly a survivor, Leanne, and there are simple things that I did to survive. Leanne, I've been putting my blood sugar level at an required level that is between 5 and 7 millimole. And now, with that, Leanne, diabetes on its own is a pandemic. So I've been living with two pandemics, corona when I was diagnosed, as well as diabetes. But for me to beat diabetes, to beat corona, of which I would love to share this information to each and every viewer out there at home. Leanne, you have to first control your blood sugar level. You might be aware that failure to control your blood sugar level, you're putting your whole body or yourself at risk of kidney failure, blindness, heart attack or heart-related diseases, which are the complications of diabetes. Now, here comes COVID-19. So if COVID-19 found you that you've never been able or struggling to keep healthy, then you are in a very, very dangerous position. So with Million, I've always been the mouth of a healthy lifestyle, healthy living, as well as beating diabetes.
Yeah.
And currently, I'm proud to say that this year I'm doing 38 years with type 1 diabetes.
Wow.
And type 1 meaning that I depend on insulin. I take insulin every morning and every night. And I will be doing this for 38 years this year. So that has been the goal for me to succeed.
Yeah, I mean, and that is, like you say, I mean, it's like you're living through two pandemics, because diabetes is a very, very hard thing to have to control and contain, never mind having coronavirus on top of it. I think it was, you got it right in the beginning. Was it around about March, April, that you contracted coronavirus?
I contracted it around June.
About June. Yeah. And
yes,
how are you feeling?
Yeah.
How are you feeling now? Are you strong? Are you feeling well?
Leanne, I'm double well. I'm double strong. I must be honest with you. Through one thing very important, Leanne, is that when you've got when you contract this virus, your healthcare workers or doctors and nurses, they must be your friend. In the sense that when you are in isolation is not a nice period of conditions to be in your life. You're on your own for 10, 14 days, and it's only you and either your device and whether radio or TV. And then in that instance, when you watch the morning lives, they're telling you about the figures, which is true, unfortunately. Radio stations are also telling about the figures. And so now, when we're in that situation, you can imagine the anxiety and the fear, because when you're told that 715 people died in the last 24 cycle or yesterday, you're in that condition, that's fear. So I had to develop a positive attitude and then, but run away from anything that has to do with information sharing, like your TV, your radio, and I had to switch them off. Also, I had to switch off my mobile device so that I'm running away from that, and then I rest and then take the advice that the doctors have told me to take, and trying to maintain and keep down my sugar level, keep my sugar level also at the rightful or required numbers.
Yeah, so you really are, you're taking a good care of yourself, which is so important and a great example to others as well. I must say, if there's one thing we've learned out of this coronavirus, is that you need to look after yourself. You need to look after your health and well-being, make sure that you're fit, you're healthy, so that if you do unfortunately contracted, at least you have a fighting chance with your fitness and good health, even if you have comorbidities, and I think that's what you stand for. I just want to come back to you, Dr. Malemela, in terms of the mining industry. Obviously, I mean, there are tens of thousands of miners in the country, and as we said in the beginning, going back to work now, and we urging everybody to be compliant as they possibly can. But if we kind of look at the moment what the infection rate is like amongst miners, are you cognizant to those numbers? Do you have increases that are happening? What are we talking about in this second wave, which we've been told is apparently a lot more infectious?
Leanne, thank you. It is real. Remember, coronavirus infection is a public health condition. What we're seeing is a direct mirror of what our communities are experiencing. For now, we've got operations in 4 provinces in South Africa. That is the Northwest, West Rand in Gauteng, Beatrix, and Limpopo. Now, we're seeing increasing numbers in the Northwest province relative to the rest of the operations. But when you look at nationally, we know that the provincial infection rates are going up. So the key issue here is that our employees need to understand that transmissions happen 18 times in the households. And in fact, when we look at the experience from the first wave, we haven't had a single transmission within the workplace. Remember, we had the earlier days of 14 days of compulsory quarantine from hotspots, from SADC countries, and so on. Out of over 4,000 employees that we put through such quarantines, we didn't even have a single one that developed symptoms. It was zero. So it is important for everyone to understand that households are the major sources of transmission of coronavirus infections.
Gentlemen, thank you. Thank you very, very much for your time this morning, just highlighting the importance of awareness and also talking to the mining sector, people all going back to work now, and that safety, PPE, keeping vigilant and protecting others as well as yourself is of utmost importance. Dr Jameson Malemela from Sibanye Stillwater, thank you very much. Pitso as well, good to see you keeping well. Diabetes activist, defeated coronavirus with both living with diabetes and high blood pressure. Very inspirational to see he's doing so well. All right. Thanks very, very much to all of you. And let's now get you some sport.